My name is Averee Zent. My capstone project evaluated methadone treatment during incarceration and whether the benefits outweigh the risks. My committee consisted of my project chairperson, Dr. Jennifer Brunworth, and my community member, Dr. Melissa Hankey, who was the medical director of the substance abuse treatment facility involved in the study, and also a physician board certified in internal medicine, psychiatry and neurology, and addiction medicine. Medication-assisted therapy is one of the most effective treatments for opioid use disorder in the literature, but is currently underutilized in correctional centers. The purpose of this study was to evaluate the effectiveness of methadone maintenance therapy in improving outcomes for incarcerated patients with a history of drug addictions. The outcomes measured included high-risk behaviors, criminal behavior and illicit drug use, health, and behavioral stage of change according to the trans-theoretical model. The overall aim of this project was to improve care for the incarcerated population with drug addictions. Participation in methadone maintenance therapy, MMT, has been negatively correlated with high-risk behaviors such as criminal behavior, recidivism, and illicit drug use. Literature supports a correlation between medication-assisted therapy, MAT, and reductions in criminal behavior after release from incarceration. MAT has shown strong correlations with the reduction of illicit drug use in general and among individuals with HIV/AIDS. MMT has been associated with improved rates of return to community-based treatment after release from incarceration. MMT's effectiveness in improving health outcomes has yet to be determined, as current study results are mixed. However, a retrospective cohort study by Russolillo and others found significantly lower death rates among participants in MMT during medicated periods, independent of social, demographic, criminological, and health-related factors. Specifically, participants in MMT showed significant reductions in death rates caused by infectious disease and accidental poisoning, that is, overdose. Finally, the stages of change, which is a fundamental element of Prochaska and De Clemente's trans-theoretical model of intentional behavior change, has been correlated with post-treatment drinking and risk of violent offense, but is less well developed in other drugs of abuse. More research is required to ascertain the strength of an individual's stage of change as a predictor of post-treatment illicit drug use. The conceptual framework that has captured addiction and its treatment is that of Nick Heather. Heather's conceptual framework describes addiction as occurring in 3 levels, frequently described from lower to higher: neuroadaptation or physical dependence, strong desire or cravings for the drug, and failure to resist using drugs despite attempts to do so. The lower levels are not individually sufficient to create addiction, but can do so if influenced by other factors, such as setting. Central concepts in the scholarly project can be linked to those in the framework. Methadone is a treatment primarily utilized to treat the symptoms of opiate withdrawal, or level 1, physical dependence, in Heather's framework. It provides a means to alleviate body aches, sweats, rhinorrhea, and restlessness in individuals trying to stay sober but encountering the symptoms of opiate withdrawal. Methadone blocks the effects of other opioids, which prevents the euphoric or pain-relieving effects of illicit drugs, such as heroin, and decreases motivation to use such drugs. It is also dosed to control cravings, which is the second level in Heather's framework, but in conjunction with other coping mechanisms. Methadone is a component of medication-assisted therapy, meaning that methadone is meant to assist other treatments such as psychological counseling, cognitive behavioral therapy, and an exploration into addiction's underlying forces and how to eliminate or cope with them. Level 3. This form of treatment promotes supportive resources that can help individuals obtain housing, employment, and social connections that improve their quality of life. Understanding the extent to which addiction is present in an individual's life at each of the 3 levels provides important targets for therapy. With the individual's active participation, methadone can meet all 3. This study consisted of a quantitative exploratory design and retrospective chart reviews conducted at 2 points in time intended to coincide with the beginning and end of incarceration. The overall goal was to evaluate differences in outcomes for qualifying participants on methadone therapy over time. An a priori power analysis was conducted and suggested a sample of at least 52 participants to achieve adequate power. In the study, however, only 12 participants met the inclusion criteria. The study participants were obtained from a convenient sample. All participants were between the ages of 18 and 89, male, incarcerated at one state penitentiary, had a history of a drug addiction, were enrolled in the researcher's methadone program between August 15, 2019 and December 31, 2020, and were participating in methadone maintenance therapy at the time of incarceration. Participants were excluded if they were missing their records under review. All participants were incarcerated at the same penitentiary in the Midwest region of the United States. No further demographic characteristics were collected to protect the participants' anonymity. This quantitative exploratory research project was achieved by conducting the following steps. After IRB approval was obtained from Maryville University and final approvals obtained from both sites involved in the project, data collection began. The researcher was given a list of patients incarcerated within the data collection period by the clinic staff. The researcher began conducting electronic chart reviews. The dates of birth were reviewed first, and if the patient did not meet the age requirement, the chart was closed and excluded from further review. If records for the outcomes under study were missing from the chart was closed and excluded from further review. The earliest data for each respective participant in the data collection period was collected along with the final data in the period. The final data may have consisted of the end of incarceration for some participants. Data was charted on the researcher's data collection sheet. No patient identifiers were collected or documented. Data was statistically analyzed. All data was stored on a password-protected computer in a locked office at all times. Finally, a summary and analysis report was written according to university guidelines. The risk of breach of confidentiality was mitigated by coding patients as patient 1, 2, and so on, while including no patient identifiers on the data collection sheet. All study documents were stored on a password-protected computer, which was stored in a locked office at all times. No individual information was disclosed to clinic or penitentiary staff. I have reiterated the outcomes of the study on the left and included the representative variables for each outcome on the right. Urine drug screens are generally collected randomly every month by a nurse at the correctional facility. The results are relayed to nursing at the substance abuse clinic that coordinates the participants' methadone treatment. The urine drug test screened for a panel of 12 substances. The results were expected to be positive for methadone for the records under review. Provider notes from the electronic health record were utilized to collect data on the participants' reported health concerns during each attended provider appointment. Appointments were generally held via telehealth. Symptoms were identified as related to withdrawal or not related to withdrawal from the provider's interpretation. Mental health care level documents are completed by licensed professional counselors at the correctional facility and contain assessments of medication compliance, suicidality, violent ideation, diagnosis, and behavioral stage of change. Data was collected from the sections on violent ideation, assaultive behavior, and behavioral stage of change as assessed by the licensed counselor at the correctional facility. Lastly, the researcher used a data collection worksheet to collect and analyze data after conducting an extensive literature review. This scholarly project aimed to collect descriptive statistics from a sample of incarcerated participants who were receiving methadone maintenance therapy as a treatment for drug addiction and compare outcome data for each participant over time. Descriptive statistics, including measures of central tendency, dispersion, shape, and outliers, were calculated. The variables measured in the study consisted of nominal, ordinal, and scale data. The researcher's intention was to utilize the following tests to compare dependent data over time: the paired t-test for scale data, the Wilcoxon test for ordinal data, and the McNamer test for nominal data. However, since the sample size was 12, only descriptive statistics were used to characterize the results for the nominal and scale data, and the Wilcoxon test was used to evaluate differences in the ordinal data. The changes in statistical tests were implemented to avoid obscuring the comparisons. The most current version of the statistical package for the social sciences, version 27 of SPSS, available was used to compute the statistics. None of the participants reported violent ideation at the start or end of the data collection period. More participants had a documented number of assaults in the 0 to 1 range than in the 2 to 5 or greater than 5 ranges at the initial data collection point. At the final data collection point, more participants had committed assaults in the greater than 5 range. There were no positive drug screens for illicit substances for any of the participants at the initial or final data collection points. At the initial data collection point, 50% of participants reported 0 symptoms unrelated to withdrawal. 25% reported 1 symptom, 16.7% reported 2 symptoms, and 8.3% reported 3 symptoms. At the final data collection point, fewer participants reported 0 and 3 symptoms, and more participants reported 1 symptom unrelated to withdrawal. Most participants, 58.3%, reported at least 4 symptoms related to opiate withdrawal at the initial data collection point. This percentage decreased to 33.3% at the final data collection point. Finally, 50% of the participants maintained their behavioral stage of change throughout the data collection period, 41.7% progressed, and 8.3% regressed. The related samples Wilcoxon signed rank test was conducted for the outcomes of ordinal data, which were the number of assaults and the stages of change. The Wilcoxon test evaluates differences between the medians of the initial and final data. No significant differences from the initial to final outcome data were indicated for the number of assaults with a p-value of 0.18 or the stages of change with a p-value of 0.08. The purpose of this scholarly project was to evaluate the effectiveness of MMT in improving outcomes for incarcerated male adults with drug addictions, with the overall aim of improving care for this vulnerable population. Inferential statistics were not applied to all data due to the small sample size precluding statistically meaningful comparisons, so descriptive statistics were utilized to portray the data in a meaningful manner. The data for which inferential statistics could be applied, the number of assaults and stages of change, indicated no significant differences between the initial and final outcome data. Therefore, the results of this study are not sufficient to justify the utility of MMT in improving outcomes for incarcerated adults with drug addictions. Because only descriptive statistics were used to characterize the nominal and scale data in the study, no statistical inferences can be made for the data representing illicit drug use and health outcomes. None of the participants reported violent ideation at the start or end of the data collection period, suggesting that violent ideation was either not a significant factor in the sample throughout the data collection period, or that it was not openly communicated to the participants' licensed counselors during their evaluations. The lack of positive drug screens throughout the data collection period for any participant might suggest MMT was an effective method to treat addiction. Alternatively, this finding may reflect limited accessibility of illicit drugs in this penitentiary, which is desirable in the correctional and rehabilitative setting. Regarding the reported symptoms unrelated to withdrawal, one more participant reported at least 1 symptom at the final data collection point than at the initial data collection point. This finding may suggest that MMT is not correlated with improved health as previous studies have indicated. However, confounding factors included the coronavirus pandemic and incarceration itself in a communal setting. Finally, fewer participants reported at least 4 symptoms of opiate withdrawal at the end of the data collection period, which may suggest that MMT is effective in treating withdrawal symptoms, which aligns with its pharmacologic mechanism of action. Statistical inferences can be drawn for the ordinal data representing the number of assaults and progression through the stages of change. No statistically significant differences were found for the number of assaults at the initial and final data collection points. This finding suggests MMT did not have a profound effect on assaultive behavior in this sample, despite studies suggesting that MMT is correlated with reduced violent offenses and recidivism rates after release from incarceration. Finally, more participants progressed through the stages of change in the data collection period than maintained or regressed. However, no significant differences were indicated at the standard threshold with a p-value of 0.08. Therefore, a tentative conclusion to be drawn from this data is that MMT does not significantly impact progression through the stages of change. The current literature, including several randomized controlled trials, supports a correlation between medication-assisted therapy and reduced illicit drug use, reduced criminal behavior after release from incarceration, and improved rates of return to community-based treatment. However, findings regarding the influence of MMT on health outcomes have been mixed. No study was identified in the extensive literature review conducted that investigated the effects of MMT on progression through the stages of change. Finally, very few of the studies in the literature review studied the incarcerated population specifically. Strengths of this scholarly project included an evaluation of understudied outcomes in a vulnerable population. Although the results of this explorative study were not statistically significant, the findings will provide a foundation for future research to improve the care of incarcerated individuals with drug addictions and advance the nursing body of evidence, which was the project's overall aim. Several limitations existed on the study's generalizability. First, the study was conducted in a state where more than 1/3 of the population resides in rural areas. Because of the small sample size and geographic area, demographic data were not collected in order to protect the anonymity of the participants. Second, the sample of participants was a convenience sample consisting of only males and not randomized. Thus, the sample may not represent all incarcerated individuals with drug addictions, especially those in inner city areas and females. A significant limitation to the validity of this study was the coronavirus pandemic's effects, which introduced several confounding factors to the study. First, visitor restrictions imposed by the pandemic altered the lines of communication, dose adjustments, and frequency of contact between the participants and the clinic. As a result, the participants had fewer opportunities to request and receive adjustments to their methadone therapy. Second, data were not collected on whether the participants acquired coronavirus infection throughout the study, which may have influenced the health outcome. Third, the pandemic may have influenced the reporting of health symptoms to the participants' providers. Finally, the psychological stress of the pandemic may have influenced the rates of assaults and progression through the stages of change. These factors were not accounted for in the study's design or data collection period, thus limiting the study's validity. A final limitation of the study was that no comparison group was accessible to the researcher. Data from a separate sample of participants with drug addictions but not undergoing MMT throughout their incarceration would have eliminated several confounding factors related to incarceration and time, improving the study's validity. Mitigating this limitation with improved access to a comparison group would be a valuable addition to future research on this topic. In the time of the opioid epidemic, any research on this topic has significant implications. The findings of this project have several implications for practice, future research, healthcare policy, and quality and safety. The results of this scholarly project will add to the current evidence base, contributing to the improvement of direct care provided to incarcerated individuals with opioid use disorder. This study did not replicate previous correlations, but it is not easy to distinguish the effect of MMT from other potentially confounding factors. Regardless of the effectiveness of MMT on these outcomes, findings from high-quality studies will inform the best practices to be implemented in caring for this vulnerable population. This study was one of a select few that specifically focused on the incarcerated population and the only study found in the extensive literature review conducted that evaluated the effects of MMT on the progression through the stages of change. Future researchers can incorporate the findings from the study into the design of other high-quality studies addressing such gaps in the literature. The findings from this study have significant implications for healthcare policy in the age of the opioid epidemic. The risk of death due to drug overdose is significantly higher for individuals who have been incarcerated than the general population. Incarceration often disrupts treatment for individuals with drug addictions, and such disruptions in treatment have been correlated with increased incidence of illness such as infectious disease. In the past, the use of MMT has been limited to a small selection of qualified individuals in prison, namely pregnant female offenders, and findings from such studies as this can ensure the accessibility of treatment is based on current evidence. Additionally, recidivism is a serious concern for healthcare policymakers. The results of this study will assist in creating effective healthcare policies to improve these outcomes. The study aimed to improve the quality of care provided to the incarcerated population with drug addictions. Additionally, the literature has shown that medication-assisted therapy has been correlated with improved quality of life in the physical, psychological, and social domains. Decreasing recidivism rates will improve the safety of individuals with drug addictions and society at large. If MMT does not have a significant effect on these outcomes in multiple rigorous studies, space can be created in clinical practice for other, more effective interventions that can improve quality and safety in this population. Although the findings of this scholarly project did not replicate studies in the literature, the project satisfied the aim of exploring the effectiveness of methadone on relatively understudied outcomes in a sensitive population. The small sample size in this study was a substantial limitation in identifying statistically meaningful results. As such, the study can serve as part of the foundation for future researchers who can mitigate some of the limitations by obtaining a larger sample size consisting of both males and females, a comparison group, and timing that is not affected by a global pandemic when evaluating health-related outcomes. More research is needed to identify interventions to improve outcomes for this population, a feat that, when completed, will benefit the lives of individuals with drug addictions and those affected by them, the practice standards of healthcare providers, and the well-being of society at large. Thank you for listening to my presentation, and I look forward to reviewing and responding to questions and feedback. Thank you again for your time.